to have you today, and thank you so much for joining us. I am with the South-Southwest Prevention Technology Transfer Center and the Mid-America Prevention Technology Transfer Center. I will be moderating the webinar today, so you'll hear from me at different points. If you have attended our other webinar series, you've heard from me several times, so I will let you hear from someone else who is way more wonderful. This is Kareem Alimo, and we are so thrilled to have her. I've done a lot of work with her in the past, so I was so excited that she could do this. She has more than 15 years of experience providing substance misuse prevention training and technical assistance at the local, state, and national levels. She develops and delivers TTA that builds grantee capacity to assess needs, create data-driven plans, implement evidence-based interventions, and evaluate initiatives. And I can tell you that Kareem is an amazing trainer and has put a lot of thought into this training today. And so please feel free to ask her questions, and if we can't answer them or if we have too many, then we will make sure that we get those answered for you. I'm going to turn the time over to Kareem now to begin our presentation. Thank you for joining us.
Thank you so much for that very warm welcome, and I'm so glad to be able to be here and talk with you all. And I know that there's so much experience on the phone and listening, so I'll be looking forward to hearing what you all are doing in your communities, and I think that's really where we get the wealth of information is from each other. But I will kind of facilitate that conversation by talking about some of the pieces of implementation. So just to jump right in. As you've heard before, I think it looks like about 80%, 70 to 80% had listened to the assessment capacity and or planning webinars before this. So what was talked about in those webinars was that the fifth process is not a linear process, but it is one that you want to go through the steps in order to really build a good foundation in order. And then, of course, it is circular, so you're always going back to thinking about assessment and capacity and planning. So if you have not listened to one of those first webinars, I really encourage you to listen to those so that you really get a good sense of this five-step process and get the good foundation for what leads to implementation, because those first three steps are really going to be what set the foundation for your implementation to go smoothly. So what are we going to talk about today? The first objective is to describe elements of a high-quality implementation and why it's important. We're also going to explain how to balance fidelity with adaptation, identify important factors to retaining core components of programs and practices, and identify keys to establishing support. This is what SAMHSA has put together for the key components of implementation, this visual. So there are four main parts, and the first one is delivering programs and practices. And in order to do that first piece, you need to be able to do these other three pieces. So balancing fidelity with planned adaptation, always retaining core components, and establishing implementation supports and monitoring implementation. So those are the four pieces that we're going to talk about today. So how did we get here? So it looks like, I think it was about 80% of you looked at assessment and capacity webinars. Again, I'm going to keep making the pitch that if you haven't gone to watch them, to go back and watch them, because the previous steps are imperative to success in the SPIF. If implementation is the house, then the first 3 steps are really the foundation, and you don't want that foundation to be soft. You want it to be solid so that when you start putting the weight on, it's not sinking. So in the planning phase, Dr. Hayden Fenner talked about the fact that the SPIF is not linear. So you may be in implementation and realize there's something that you have missed in assessment, and you go back in order to make sure that you collect a little more information on assessment. But you really want to start with making sure you have a good, solid assessment. You're building capacity, and this is essential because you'll see a couple of the pieces that we talk about today are about making sure that you have the capacity in order to implement, so incredibly essential. And that you have a phenomenal plan. Many times we want to, our coalitions, our teams, they really want to jump into what's the fun stuff. Because in implementation, you see the do and you see what happens, and you can get really excited about it. But I will say over and over that in order for you to be really successful here, you really want to make sure that you're thinking about these first 3 steps. And with that, one of the ones that I emphasize the most is the planning step. So I always say that if you were going to go to Europe and you didn't do any planning, you probably wouldn't make it to Europe because you'd first have to start with getting your passport on time. And then in the world that we're living in with travel restrictions and things that are going on, that makes it all the more imperative that you need to have a really good plan if you're going to do any type of travel. So in the same way, you want to make sure that you're thinking about how you're planning in order to get where you need to go in the implementation stage. Otherwise, you'll end up being just where you started, or even kind of backing up. So one of the things that you really want to ask is it practical? Is it effective? Is it cost effective? Is it sustainable? Those are all the pieces you want to think about in this planning phase. And once you've thought through those, then you are really ready to get into the implementation phase. So hopefully I sold you guys going back to looking at some of those other webinars if you hadn't already, though it looks like a good number of you have, which means that you are ready to jump into implementation. So like I said before, although delivering programs and practices comes first on this image, you really have to consider the other pieces in order to do it well. When delivering programs and practices, you'll need to balance fidelity with, and the main word here is planned adaptations. So really thinking about planning those out. Retain the core components. When planning adaptation, making sure that you're mobilizing supports for your effort and that you're monitoring your efforts. All of these pieces are interlaced in a way that's different than any other step. So in other steps, in other steps in the SPIF, these images you'll see are very discrete. But in implementation, they build on each other so much that they really are interwoven. But there are 2 main overarching questions for this step. The one is, have you built the infrastructure you need to support effective implementation of your plan? And 2, how will you know that your plan is being implemented as intended? Those are the 2 overarching questions that you want to think of when you're in this step. So in order to help organize this training, I pulled apart these pieces of this image, and you'll see that on the top right-hand corner of the slide so that you know what piece we're talking about. Again, though, they do overlap a lot. So I wanted to let me know if there's any questions that come in the chat. Matched up a program or practice with a risk or protective factor that you prioritize. Ideally, these programs or practices are strategies that have shown positive outcomes with some sort of evaluation. They may be individual, like school-based curriculum, relationship, like parenting programs, community or school-based policy, society, sometimes that's policy as well. Ideally, you have ones that hit multiple of these in order to get the best impact. How you look at fidelity and adaptation will probably differ depending on the type of program and practice and who the audience is, where it falls in this visual. It may be even harder to track for certain pieces. So it may be harder to track fidelity for one that is policy or society than something that is very concrete, and school-based curriculum is sometimes very easy to track. That being said, the guidelines are the same regardless. So we'll talk a little bit about some of those guidelines next. If you have already completed planning, I'd love to hear what are some of the strategies that you've chosen. So feel free to jump into the chat and talk about what are some of those programs and practices. And so sometimes we say programs, practices, strategies, interventions. Those are all words that were used. Would love to hear some of those that link back to your risk and protective factors coming. So the second piece in that visual that we first showed about implementation was building fidelity with plan adaptation. So the best way to implement evidence-based interventions is with fidelity. The only way to know if you're doing that is to know what makes the intervention successful. So making sure that you know the components. What is fidelity? It's a word that we throw out there, but in prevention, but what it really comes down to is fidelity is the extent to which a program or practice is implemented as intended. And to really implement a program and practice as intended, you need to know what was intended in the first place. So the implementing of interventions with fidelity, that's the gold standard. If you're using a school-based curriculum, promising practices, you might be able to, it might feel easy to track. Many times these types of programs have very specific guidelines that really clearly describe the most important core components that make it successful. They may not be as easy to implement with fidelity though. You may have snow days or other school priorities, or schools may be canceled, as we saw recently, which was really not anything that anybody could plan for. That being said, in order to make sure that you stick to an intervention with fidelity, you'll really want to brainstorm with others what potential obstacles there could be before implementation. So really thinking about this, we're talking about it in implementation, but thinking about it in planning. So will there be snow days? Will other things come up? And how can we make sure that there isn't pieces that are cut out of it when those things come up? What are our contingency plans? And having that brainstorm with others that have been in similar circumstances is huge, because it might be something that you don't necessarily think of. So it doesn't necessarily just have to be a brainstorm in your community. You can, and we'll talk a little more about this later, but you can go out and talk to others in other communities that have done it in the past to hear about what got in the way and really plan for that well. So knowing the curriculum well is going to help with that, and suggesting even connecting with those who develop the curriculum, because they're really going to know what those core components or procedures are that make sure that you need to have in order to be successful. So that kind of leads us into the next piece. It's the balance of adaptation and fidelity. making sure that Fidelity is the gold standard, but there are times that come up that are hopefully you're planning for, but sometimes unexpected, that mean that you'll have to adapt to the situation. So if Fidelity is the degree to which a program or practice is implemented as intended, Adaptation describes how much and in which ways a program or practice is changed to meet local circumstances. A lot of the research has shown that although Fidelity, again, is that gold standard, in real-world settings, it's unrealistic to expect perfection. An activity, it may actually be helpful to, if a well-planned adaptation may be helpful to prevention as a whole. And sometimes this happens like with cultural adaptations, which I think we talked about in the chat as well, is ways that you can adapt this culturally. If it's planned well and evaluated, then that can lead to more that people can then choose from as an evidence-based intervention. So it can give to our world as preventionists. And so it's not necessarily a bad thing. It's just making sure that we do it well. And so I see that there's a question in the chat that says, are cultural adaptations acceptable? And I think that's really where you want to have those conversations with the person who created the intervention or program or practice in the first place, to know what types of adaptations are acceptable. What are these core components that have led to success, and what can be changed? So many times language is changed as a cultural adaptation. We'll talk a little bit about things to consider when making adaptations, but I think that's usually where adaptations happen, is culturally, because when it's gone through research-based, might be with one group of people, that, but when it's actually being used in the real world, it may be a different group of people that you're working with. So I think that's a really important point. Thanks. So what are some guidelines to think about when balancing fidelity and adaptation? First, you really want to build capacity before changing the program. So you don't want to change a program because you don't have the capacity to do it, because you don't have the people on the ground, because you don't have the training, which it sounds like, yeah, of course you want the capacity to do it, but it happens all the time that people don't have the ability to do the right training, so adaptation happens on the spot. So making sure that you're thinking about this in the capacity phase, in the planning phase, that you're not changing the program because of your capacity, you're building your capacity to meet that program. Retaining core components. So this, I will say over and over again, and it kind of goes with that third bullet. You want to add rather than subtract, and that makes sure that you're not losing those core components, because the last thing you would want to do is take something out of a program or practice, and that was really an important piece to making that successful and to what the evidence provided of making that successful. So that's why you want to have some of those conversations with those who have done it before, with the people who've created it if possible, and a lot of times on these registries it will give you contact information for who created it, so you can have those conversations about the core components. Adapting with care. So it keeps saying the plan adaptations. You really want to think about how you're adapting and making sure that you're getting help. I'm just looking through the chat to see. Hopefully everybody can hear okay. I know there's a lot of people on this one. All right.
If you're skipping out on, if your audio is skipping out, sometimes that's your internet connection. So maybe your internet coming in and out.
Okay, sounds like it looks like people can hear, so I'll keep going. So breaking these down, making sure that you're building capacity before you're changing the program. Rather than changing the program to fit the local conditions, consider ways to develop resources, to build local readiness, so huge capacity piece, so that this can be, so whatever the program or practice is can be delivered as designed. And when you're prioritizing what program or practice to use, this is one of the things that you're thinking about, is whether or not you have the readiness the readiness and the capacity to be able to implement. So you really want to be thinking about this in planning, and so that you don't get to implementation and realize that there are some pieces that are missing. It's making sure that you're building the capacity. It's only going to increase the chances that it'll be successful. But I'd be curious to hear from you all, are there ways that you've gone about building capacity in order to implement the program? Go ahead and write in the chat. And another, as you guys are typing, not only is it in the moment helping you to be more successful, it's also making sure that it's sustainable beyond you. Yes. I'm not sure if we can get the ideas from a few minutes ago, but we will check into that. There were some really good ones. And let me know how you built that capacity. So implementing train the trainer is building huge capacity. If two people go in and do the same thing without train the trainer, it may look very, very different even with the same materials. Training volunteers before implementing a program, so huge. Emails, text, story sharing, yes. Social media shares, webinar shares, eliminating barriers to attendance, transportation. Big things to think about that, and this is where talking to people who have done it before is huge, because you may not think about some of these, providing meals, for strengthening families. Those are things that are so important to making sure people get there, and so thinking about that beforehand and putting things in place to make that happen. Creating buy-in. Yep, we'll talk a little bit about that and how important it is to have the right people. That's huge. I'll let you guys keep typing, because I think hearing what you all have done to build capacity is so helpful for everybody else who's on the phone. I think training is number one, and sometimes it gets forgotten if it's not specifically in something like a Strengthening Families program. But anything that you're doing, it's really important to make sure that you're doing training so that two people are doing the same thing. Transitioning in-person training to virtual format. Yes, this is going to mean that we're doing a lot of thinking about adapting, because we're having to adapt to the situation. So ideally, you're planning adaptations beforehand. Sometimes you have to move in the moment, and with that, making sure you're still thinking about and planning what those adaptations will be, and how you will, and documenting it. Communities that care work plan, identifying resources available through community partners. Yes, it's huge, because this is the work that we do is not just our work behind a desk. It's community work. So making sure we have partners with us, a support group to boost community bonding, strengthening families. Thanks. All right, so I'm going to move to the next slide, but this all links in. So keep adding stuff to the chat, because this all connects. And you'll see up in the right-hand corner of this one, there's balancing fidelity with plan adaptations and retaining core components. There's two pieces of that first visual of implementation. Because they're so interlaced, one of the main pieces of building fidelity with plan adaptations is retaining core components. And so now we'll talk a little bit about what does it mean to retain core components. So the number one thing is preserving setting as well as the number and length of sessions. So whether in setting, something that works in a school setting may not work in a health clinic setting. When you're thinking about media campaigns, something that worked and was evaluated in a poster or on TV may not work as well in social media or in print. So keeping all of those things, and then how many times did it happen for something that's very clear and distinct, like a school curriculum, it may be very obvious what the number and length of sessions are. But for some of these more global strategies, you want to still think about how many times was this on TV, how many times was this posted. If you're thinking about media campaigns, you want to think about where were there posters in the school, on every floor, all of those pieces that seem very small. You want to make sure that you ask those questions, especially if you're pulling something that was evaluated, because you want to make sure that you're doing the exact same thing. And if you change it up a little bit and it doesn't work, you want to know, does this not work because of what I did, or because of the community, it just didn't hit right. So in order to really know that, you have to make sure that you're looking at the core components and you're sticking to them. So the first one is the number and length of sessions. The second one is preserve key program content. So again, remember it's safer to add rather than subtract. This will prevent you from removing core content. So if there's a specific topic that you want to add, rather than subbing it in for something, add it in as an additional piece. Add new content with care. Consider program guidance and prevention research. So making sure that you're really thinking through what has been done in the past and has it worked in the past before adding a new piece of content, and has it worked together. There's a lot of research. People have tried a lot of different things out there. So really thinking about what has happened in the past will help you do it in an educated way. And identify the best possible candidate to deliver the program. So making sure that you're thinking about when it comes to cultural, when it comes to training, that you're really getting the person delivering that program that is the right fit. And I see lots going on in the one of the things that when it comes to core components, an example I wanted to mention that was is that in one Native American community, looking at a parenting program to prevent youth substance use, community members worked with university researchers and so this is the planning piece, to adapt an evidence-based program that was originally developed for Latino parents. They selected it because it reflected the same risk and protective factors that they had prioritized. But together, they took a look at it and incorporated the Native American values of parenting, challenges specific to the Native American experience, as well as the cultural elements like storytelling. And they made sure to evaluate it. So they were able to show that even though it was culturally adapted, they showed that there were increases in parenting skills, decrease in negative behaviors. So all of those pieces are really important when you're thinking about the core components. Although they adapted it, they made sure that they were keeping all of the core components, and because they were able to work with those at the university, they were able to really analyze it and plan. So that's an ideal adaptation. And that really goes into this next piece, is that you want to make sure that when you're adapting, you're doing it with care and thoughtfulness. Just like these gears on this picture, they have a lot of pieces that come together to make the clock work. So if you don't know how they work and you start taking it apart and putting new pieces in, you're going to have issues. But if you know how all the pieces work and interact, and there's a piece that's just not working right, you can replace it with a piece that will intersect and still work with the clock. The main idea of making sure that you stick with the core components is really knowing the intricacies of how it works. And so the last piece is establishing support. And what does that look like? So again, making sure that there's a favorable prevention history, an individual or organization that has positive experiences with implementing prevention programs or practices are more likely to be willing to support them in the future. If that hasn't been the case, then you want to build capacity here, of making sure that people are favorable to prevention. It's key to have leadership and administrative support. So again, this is all stuff that in the capacity stage you're really looking at. And what I said earlier, provider selection, you want to have someone who's really, really committed to the work that you're doing. You want someone who's qualified, someone who's trained or that you can train. You want someone who has a good cultural match for the focus population. And you really want someone who's willing to learn through the process, because prevention is a learning process. So you don't want someone who just wants to learn at the beginning how to do it and then they do it. You really want someone who's in the moment and really learning as they're doing stuff. And that links right in with providing training and support. So not just before something's happened, but before you implement an intervention or program or practice, but throughout the process. So in-service training as well. You want to make sure that you have a clear action plan. This starts in your planning phase, but you're going, in order to see whether or not you've been faithful or you've had fidelity to a plan, you need a plan in the first place, and it needs to be extremely specific. Having a really specific plan is going to show whether or not you have, you've been faithful to it. And the last piece is implementation and monitoring. And this is such an essential piece. By closely monitoring and evaluating the delivery of a program or practice, planners can really make sure that it's being implemented as intended, and that if there needs to be any improvement, that it can be made. By assessing program outcomes, planners can sustain it over time and promote the sustaining it over time. So I'm going to jump into this. I have a slide just for this one, just because I want to make sure that when it comes to both fidelity and when it comes to monitoring adaptations and whether they work, this is a huge piece. So I wanted to make sure to bold this one. By closely monitoring a program or practice, communities can make sure that it's implemented as intended and improved. So you don't want to find out that after the fact there was something that came up midstream that you weren't able to improve, because now you're waiting until the evaluation phase before you're seeing it. You want to see it as it's happening. So by monitoring, you're really catching stuff that's not going right, or making sure you're making those improvements. By assessing the program or practice, communities can determine the outcomes. Communities can determine whether or not it's working as intended and it's working and it's worth investing over time. You don't want to invest in something that's not working. Just because it worked, it's evidence-based doesn't mean it's necessarily the right fit for your community. And by sharing this information with your community, it can help build sustainability because people are invested, so you can show that it's working. So with that, I'd love to hear one thing that you can do over the next 3 to 6 months to integrate what we've talked about today into your implementation planning efforts, and while you're writing in the chat, I'm going to look at the chat and see if there are any questions that were missed. See, there's lots of questions about emailing the survey link, and I believe that is possible, yes. And the PowerPoint will come in with the email with the recording. You can access all previous recordings as well. Prevention, flexibility, and action. I like it. Think I got all the questions. And looking, at present, we're building capacity to implement our substance use prevention program in a virtual format. Huge. This is a huge thing. And it'd be essential to make sure that you're collecting evaluation information, because can you imagine what information that would give others who might be in a similar situation that they have to go virtual? And if you show that it does work, then that's going to be a huge add to the prevention system. So additional program monitoring. I love it. I love to hear that. I want to be able to share the slides so everyone on the team has a better understanding of implementation. Yeah, I think a lot of times we think of implementation as like, just go out and do it. But these really break it down, and I love the way that Tim has gone about breaking it down into really concrete steps and concrete things to think about, so that we're really doing it with intention and we're not just jumping into things. And we're thinking about whether or not they work so that they can be sustainable over time. Working with prevention partners through a story and turning it into viable, fidelity-based, adaptational, and sustainability plans. Lots of evaluation, lots of planning. I love it. Oh, the two questions at the beginning: have you built the infrastructure needed to support implementation? And are you doing what you said that you were going to do? Those are the two pieces of implementation. Working with our curriculum founder to keep fidelity of evidence-based programs. Providing programs while still adhering to social distance and community concerns. We're working closely with our curriculum founder. Okay, I think that's huge, is being able to get access to that. And we'll have resources for evidence-based programs and practices, and a lot of times on those, when it's on the website, and a lot of times on those, it'll have who is implemented, who the creator was, so that you can get in contact with them.
I think it's really interesting.
That I've given in the past is, and it's not to substance abuse prevention, but when I was in grad school, someone was working in Africa, and there was, they were getting medicine in, and they were tracking it, and they were tracking rates, and there was a huge storm and flooding, and the medication was not able to get in for, I think it was like a month, and rates went up. And if they hadn't been tracking fidelity, they would have assumed that the medication wasn't working, there was something wrong with it. But in fact, there was just something that happened that interfered. And so in the end, I think in situations like that, the tracking also helps you to explain if there were changes in rates over time. Why were those rates? It may not be an issue with your program or practice. It may be that there was something unexpected that happened, and you had to go virtual, and maybe virtual didn't work, and then when you went back, you saw that it worked in a normal situation, or you find that it worked great in the virtual world and you just added to what prevention practitioners can do. So it's just so huge to make sure that you're tracking things. But I think we'll have a lot of good information about what can be done in the virtual world from all of our adaptation over the last couple